If you're looking for do-it-yourself hip and back pain relief exercises, you are going to want to learn how to do Pilates leg slides, which are also known as heel slides. Hi, I'm Sarah Stockett, the creator of Custom Pilates and Yoga, and I'm going to teach you the right way to do these leg slides so that you can find the most therapeutic relief and help you get rid of your hip and back pain. All right, so the number one thing you need to know about doing a Pilates leg slide or a heel slide, whatever you want to call it, is that you need to really pay attention to how your body feels and if your body moves. We're going to begin on our backs. We're going to stay on our backs for the full exercise. So go ahead, come onto your back. And I want you to take a minute to get yourself completely aligned and neutral. We want to have the rib cage angled straight down to the hips. And if you're not sure if your rib cage is angled down, you can slide your hands at the outside of the ribs. Find these muscles in the front. They don't work very often. When you find those abdominal muscles, you will notice it. And then check out your pelvis. You're gonna make a triangle with your pointer fingers and your thumbs. Place it on the top of your hips. And when you look on down, your thumbs and your pointer fingers should be in the same plane. Also, you might be able to tell if your pelvis is in neutral because you should have a curve to your low back. Your low back should be lifted up off the mat. All right, so we want to have a very great neutral spine. We've got the work going at the bottom of the rib cage. And now I want you to take a relaxing breath. Okay, so big breath. And then let it out. And I want you to really feel like you're deflating. Let everything inside you turn to jelly. We're not pushing, we're not squeezing, none of that. Just let everything deflate. And if you're not sure, take your hand, move in a clockwise circle. You can even use both hands. Help massage everything. Let it sink down toward your spine without letting your spine collapse toward the mat. All right, now this is really crucial. The setup that we've been doing is really important because we're getting ourselves in our very best neutral position, and now we're going to work on strengthening our muscles to hold us here, okay? So we're at our very best neutral, we're slimmed down, we're angled correctly, and we're going to slide a leg out and challenge whether our abdominals can hold us correctly in this position. Okay, so after you've gotten all deflated, just very lightly try to find your deepest abdominal muscle and feel like you're gently hugging your internal organs. I know, that's a pretty creepy thought, but go ahead, give it a try. Arms are by your sides, flex your right foot. Now, you're gonna inhale, slide your right leg out straight. Let it slide along the mat. Exhale to bring it up. You wanna make sure as you do that your low back doesn't crumple toward the ground, your hip doesn't rock to the side. We don't have any sort of weight shifting going on here. So everything is settled down toward your spine in neutral. Inhale that right leg out. Exhale back up. Now we'll go again. Inhale out. Exhale up. And as I do this, I'm imagining my heel is connected to my sits bone, which is this bony part of your bottom that you can feel with your hands. And I think of a rubber band connecting them. So as I slide out or hop, depending on how sticky your mat is, I'm stretching that rubber band and I feel that tension and it helps me come back up. So I go and I find maximal tension and then I bring it back up, okay? This is a single side leg slide. Now we're gonna switch, we'll do the left side. Left side slides out and come on up. And you wanna make sure as you move that you're not having your hips rock, you're not feeling any sort of muscles grip and kind of push up to the surface, especially on the front of your hips. Okay, if you do feel a muscle that hops up, that's okay, that's normal. Just take your thumbs, dig into your hip sockets, massage, push your thigh bones away from you, and it's gonna stretch that muscle up for you, okay? Legs sliding here, inhale out, exhale up. We wanna keep everything settled down toward the spine, lightly active with those abdominal muscles. Inhale through the nose, exhale through pursed lips. Let's do one more. And lower the toes. Okay, so this is great because lots of times if you have a hip injury, if you have a back injury, just doing one side at a time is going to give you a lot of information and give you an idea of where you need to go from there. For example, you might do your right side and it's a total train wreck and your hips are moving back and forth, your low back is reaching down, nothing is stable. That's okay. Just take your time. Try to do every leg slide to the very, very best of your ability. And then when your weaker side has had enough, you'll go ahead, you'll do your reps on your stronger side. Let your weaker side set the pace. Okay, you're working on therapy, so you're working on strengthening the weak area. That just let the strong area tag along, okay? That's totally fine. But maybe you're in a situation where you're stable, you can do the single side leg slides, and you're doing that well, but you are still working on some hip or low back pain issues, and you're wanting to get stronger, and so you're wanting to strengthen these stabilizing muscles. Well, good news. There's more that you can do with the leg slides. So in this position, you can do alternating. All right, now this is gonna bump it up to a moderate level intensity, okay? So find those abdominals. It will be inhale, slide the right leg out. Exhale up. Now we'll do the left leg. Inhale out. Exhale up. And you'll go back and forth, sliding the legs, keeping everything quiet through the hips so that there's no rocking or moving back and forth, unless of course your foot sticks and hops like mine tends to do sometimes. Slide, and then last time over here on the left. But if you can do that alternate side leg slide and still feel really good and really confident, then you might want to take it up a notch to reciprocal movement. Now, reciprocal is when the right leg is out, that left leg is going to make a switch. And same thing, back and forth, you'll go back and forth. Now, this is more of an advanced version of the leg slide. So I'm going to take a moment, I'm going to find my ribs, find my abdominals, hug in, get my determination in focus. Here we go, inhale. Last set. All right, now when you do your leg slides, I'd say the maximum number that you want to do is 10 sets. So that's 10 on the right, 10 on the left, or 10 going back and forth, depending on if you're doing alternating and reciprocal. I hope that you've enjoyed this video about heel slides and the Pilates leg slide, which are the same thing. If you have, please give it a thumbs up and subscribe to my channel. And for more information on this and other therapeutic exercises for hip and back pain, please visit my website, www.custompilatesandyoga.com. Thank you.